Wherever you go in rural, regional or remote New South Wales, you'll see improvements in the way we deliver health services to our communities. We're designing, building and enhancing services. Through a program of major capital works, staff in every local health district in rural New South Wales are getting involved from the ground up.
We really wanted to change things, so we changed how we see patients and then we built a department to fit with that.
It's all about caring for you closer to home.
They're actually coming to a place where it's quite serene. You know, they can look out, they can see the bush. On the drive-in, they can see the cows. So it's not so foreign to them as against sort of going to a major capital city.
Where healthcare decisions are in your hands.
Look, we had the opportunity of choosing a large city hospital, but when we were looking around hospitals to choose from, we had a really great feeling when we came into the hospital, and
the staff members were really nice and friendly.
We had a really nice sense of community.
By embracing new technology, we're putting an end to costly travel and long hours on the road.
I love telehealth because I could just see the advantages of it. It was so good for the patient. It allows me to virtually connect with all the dialysis patients that dialyse outside of Dubbo. You can zoom in and see where the needle is, if it's in the right place. I'm a bit disappointed I'm so old because I love this technology and I can't imagine what else is out there.
The technology has made an amazing difference because we're able to provide the services in our own town without sending patients away. If we need to, we can take this to the actual bedside of the patient and the doctor can see the patient.
We're seizing opportunities, finding ways to use existing and emerging technology to protect our most vulnerable.
With the rollout of the electronic medical record in our health district, we saw an opportunity to flag files electronically for child protection concerns. We just incorporate training in applying the alerts into our regular child protection training. So it's 100% transferable and it's 100% sustainable.
Through innovation, we're improving your patient journey.
In winter time, we didn't hit capacity like we have previous years. We had a couple of days where we were full, but because of the discharge lounge, we were able to get patients off the ward and through and still run theatre.
This hospital allows for the viability of smaller hospitals. We support one another, so it's important for patients to be treated closer to their home.
We're being supported every step of the way.
To be able to pay back and to be a volunteer is very, very rewarding.
They're getting as much out of it as what the patients are getting out of it, and they also get really positive feedback from the families. They're very appreciative that someone else is there.
We're educating our future health workforce through school-based traineeships, setting high school students on the pathway to a rewarding career.
Exposing them to health, whether it be allied health, nursing, business administration from a medical nursing point of view. It's the front door as such to exposing our kids to health careers.
Medical students can now live and study in regional New South Wales.
They'll grow their ties. They'll meet the registrars. They'll meet the specialists. They'll feel part of the health team. We learn how it all integrates into coordinated health care.
Our communities, no matter how big or small, are at the centre of everything we do.
The centre wouldn't exist without the community's support over the years. They raised, I think, at least $1 million, and the community really wanted to build a purpose-built cancer centre, and that's what they've done.
You know, we just find talking to the community members just gives us a lot of information about our services, things that are working well, things that are not working so well, and just new ideas that perhaps we wouldn't have come up with ourselves. So they are a vital link.
And we care for every member of our community.
People sometimes often say to me on the ward, why do you keep doing this? I don't know how you work with these people. They aren't these people. I am those people. You are those people. We all could be.
Working in rural, regional and remote health is something special. We do it because we care.
Do I love my job? You bet I do.
I wouldn't choose another career. I love it.
I love my job.
And you've got to have a certain personality type to do different jobs, you know. And mine suits this one.
It would be a resounding yes, I love my job.